Hello, welcome to SymFitTV. My name is Todd Ball. I'm the clinical director at SymFit Physical Therapy and Fitness and the creator of the SymFit Healthy Fitness System. Today what we're going to discuss is neutral spine alignment and how it can prevent injuries long term. So we're stuck today in front of these computer devices, whether it's a laptop, PC at home, phone, or tablet, in collapsed postures. And over time, we're starting to condition our bodies to function from these collapsed postures. And what happens is a collapsed posture starts to turn into a forward head, starts to turn into a slight rotation, starts to turn into a slight head tilt. And then we start getting neck pain, muscles are overloaded, and we're bouncing all around town trying to treat the symptoms, when the truth is the foundation of the problem is healthy posture, or collapsed posture, and the solution is healthy posture. So today we're going to talk about what is neutral spine alignment, and then we're going to talk about how to get neutral spine alignment. So if you're looking at the skeletal system, how we are designed to function is we're designed to have our pelvis, our rib cage, and our skull lined up. We're actually supposed to be slightly anteriorly oriented, and we're supposed to be upright moving that way. But as we all know, we're spending most of our day like this. So when our upper back can stack, our lower abdominals can put our pelvis in its neutral position. When our upper back can stack, the muscles on the base of the skull that rock the skull into its neutral position can also fire. When we're in collapsed postures, we can't contract those muscles. So if collapsed upper back posture is the problem, let's talk about some solutions to counteract this negative effects and spend more time outside of collapsed upper back posture. So in terms of sitting, you're going to need some props. So one of the things we suggest is an inclined wedge pillow. So if Barb sits on this inclined wedge pillow, that props her up onto her sit bones. Why is that important? So if Barb stands up, and we go back to how Barb was sitting a moment ago and collapse upper back posture, she's sitting predominantly on her tailbone. And it's a small little surface area of stability. Her upper back is curved. All the muscles in the front of the chest and neck are tight. There's fluid in her ears that makes sure she's orientating her skull and eyes to the horizon, kind of a genetic protective mechanism. And so when she stands up, she has to arch her low back and neck to counteract the collapsed upper back posture. And that forward head posture starts to put excessive load through the neck, and the pelvis is collapsed forward, putting excessive load to the low back. So if we have her sitting upright on her sit bones, you sit down again, Barb. She's going to have to stack her upper back, rock her skull back onto that first cervical vertebrae to put the skull in its neutral position over the rib cage. Then she has to angle about 25 degrees forward onto her sit bones. So instead of sitting on her small little tailbone, she's now sitting on two sit bones and her tailbone. So that surface area of stability just increased by 500–600%, if not more. So if this is how we're supposed to sit, we're probably going to want to use some props to help us stay chest lifted throughout the day. And as you're starting to condition yourself for neutral spine alignment and how to function from neutral spine alignment, we strongly suggest some hourly mobility exercises to mobilize your upper back into this chest lift posture. So if Barb does 4 spine curls and chest lifts every few hours or every hour, and then gets back up onto her sit bones with a chest lift head nod posture, she'll start to condition herself, if she combines it with neutral spine fitness exercises, to spend the majority of her day, if not the whole day, here, preventing shoulder impingement, neck issues, pain, herniated discs. And that's specifically for the upper back and neck region. For the low back, when we sit in a collapsed posture, we have a tendency, because we're sitting on that small tailbone, to shift to the left, whether it's by crossing a leg, or it's just a subtlest shift to that left sit bone. And then our pelvis starts to collapse forward on the right. That pulls vertebrae in the lower lumbar spine to the left. When they start to get stuck out of alignment, we start overloading that lower lumbar spine asymmetrically. And you can go bounce all around town for treatment of these symptoms, but the solution to it is really improve your posture and modify your fitness program so that everything you do at the gym is reinforcing how to move with your skull, ribcage, and pelvis in alignment. And that's what the SymFit Healthy Fitness System does. If you want to learn more about neutral spine alignment and how to live a neutral spine life, please visit our website, www.symfitptandfitness.com, and have a symmetrical day.